Hi friends, I am Dr. Sukhvinder Singh Saggu, laparoscopic and bariatric surgeon from Apollo Spectra Hospital, Karol Bagh, New Delhi. Today we are going to discuss about the new variant of COVID-19, that is Delta Plus. Yes, in the Delta Plus variant has been formed due to K417N mutation in the spike protein of Delta variant. The Delta variant was already there during the second wave of COVID-19 in India. Delta Plus is a mutant strain of Delta variant only. It is not clear whether it is more transmissible or it's more virulent or its infectious rate is more. Delta Plus variant has been labeled as variant of concern by the government of India. So when we talk about the variant of concern, it means we need to see the infectivity rate of the virus, of the variant. We need to see the virulence, whether it is more virulent or less virulent, it gives more severe disease or less severe disease, or how it spreads, whether it spreads very rapid or it spreads very slow. So technically this Delta Plus is the next generation of SARS-CoV-2, or it is a B1617.2.1 or it is AY.1 is the Delta Plus variant. In India we have seen few cases, I think it is 40 plus cases. Most of the patients, they are having headache, they are having pharyngitis, they are having sore throat, some of them they are having GI symptoms. So all these symptoms are there which were there earlier in the Delta variant, also in Delta Plus variant. As we know that the severity and spread of the variant, it depends of many factors. Number one is immunity of our people. What is the level of the immunity? That can also tell about the severity and the spread of this variant in future. So what we need to do is, number one, there should be a natural immunity, because a lot of people, they are having natural infection, and because of that the natural immunity is there. Then immunity because of the vaccines. If we can ramp up the capacity of the vaccination, and at least we should vaccinate our people 50% of total population, I think we can get a good level of immunity so that we can decrease the spread and we can decrease the severity of the disease. When we don't have a particular treatment for the virus, when we don't know about the nature of the virus, then definitely the best weapon is that you should be following social distancing, the masking measures. We should be wearing masks properly, and we should be keeping ourselves away from all the gatherings, social gatherings, and the crowded places. Then the most important thing, that we should do the contact tracing properly. Then we should be reaching up to that, and we should be doing the genome sequencing so that we can get whether it is a Delta Plus variant or it's a Delta variant. And then the proper isolation would be there and proper vaccination in those places. So containment zone is an answer to decrease the spread and decrease the severity of the disease. Because it's a natural course for any virus, when there is a replication of the virus or when there is infection by the virus from one person to another person, definitely that virus is going to mutate. We have seen in the past also, and we have seen with the COVID-19, because lot of variants are there in the past for the COVID-19, and many of there would be there in the future. So this is a natural course of the virus, and mutation would be there. We need to pick those variants, and we should be implementing our policies regarding containment, regarding contact tracing, then isolation, treatment, and the most important is the vaccination. We can ramp up our vaccination drive so that maximum number of the people should be vaccinated before we would be getting the next wave of the COVID-19. So in the last, my message would be, please keep safe, be healthy, and follow all the social distancing and masking measures. Thank you so much.